think that the clients that come here feel like they've come home when they walk in the door, which is what my goal is. And I think that they understand and feel compassion from those of us who work here, because so many of us have walked in their shoes.
These days, almost everyone you meet has been touched by addiction, either as a family member in themselves. Somehow they've been touched by addiction.
I'm tired of having clients overdose. I'm tired of losing clients to drug use. And I think at this point the community is really starting to feel a heavy impact of that as well.
It's not that if someone can quit using whatever substance that they're abusing and that everything settles. It's really a life issue. It can impact families, it can impact communities.
The landscape has changed in that there's more awareness in the community about substance abuse. We're hoping to do something about the stigma. We continue to work on that. These are real people, real humans, and they shouldn't be dehumanized because of their use of drugs.
For someone to come out and say that they need help has always been extremely hard, because there's that shame that's kind of, you're wearing this cloud of shame and you're carrying it with you, whether other people see that or not, you feel that. So I think that's it makes some people very reluctant to come and get treatment. So we're trying really hard to take that stigma out of it.
I think the power, especially with a lot of the clients I work with, is they forget their value as a person. And when they're done and I see them and they finish, whether it's my groups or someone else's, and you see them and they're done and they come back. And clients who work with me tend to bring me back some art of some sort, and then they chat with me and they tell me how, their kids are home. They're whole. Their family's back. And they did that.
Much of the therapy we do with our clients is around getting them invested in change, finding the pieces that are positive with the change that they're making. And the same thing applies to the families as well. Right? This is an opportunity for an entire family system to change the way that they're operating. Substance abuse does not affect just the person that's using something. Right? This changes the way that the family deals with emotion, or deals with conflict, or the secrets they have to keep, or the stress that the other family members are going through, trying to make sure that their loved ones are okay and that they're not going to overdose, they're not going to disappear, they're not going to wind up homeless. So when we're able to bring everybody into it, I think it gives us a better opportunity to create lasting change.
There's a new modality of treatment called medication-assisted therapy, medication-assisted treatment, MAT. But between the new medicines that the primary care community has and prescribed, and what we know about the life skill side and the combating addiction behaviors from a counseling side, that combination is very important. And being able to bring those together, which is what Jefferson County Public Health is doing with us in this MAT program, that's where we bring a new modality to all the other circumstances where this kind of treatment is needed.